When dialysis is required, once the creatinine level goes above 1.5, doctors advise taking care of your kidneys. Otherwise, you may need to consider dialysis or a kidney transplant. Often, when the creatinine level exceeds 2.5, many doctors recommend dialysis. Another crucial point is that most patients do not get their GFR rate, that is the glomerulus filtration rate, tested, even though it is a simple blood test. Knowing your eGFR rate is essential to monitor kidney function and evaluate progress, especially during my treatment, Neo Ayurveda Miracle Disease treatment. For diabetic patients with diabetic neuropathy, their sugar levels often decreases during my treatment protocol. In such cases, they should regularly check their HbA1c level at least monthly once. Do not wait for 3 months. If HbA1c is less than 7, they may be able to reduce or stop insulin or tablets, but only under the guidance of their family doctor. This is because in my treatment, the endocrine part of the pancreas begins to function properly from the day 1 as per my experience. When dialysis is required, as per my opinion, by seeing thousands of patients for years, number 1, the patient has complete urine blockage. Second point is when the patient's hemoglobin level is less than 7. Third point is the patient experiences severe breathing problem. Otherwise, regardless of the creatinine level, dialysis is not necessary with my treatment. Within 5 days, edema reduces and the overall condition of the body improves significantly if the proper prescribed diet is followed. Further, I would like to tell you all, merely following my defined diet, you will see small changes. Then automatically you will know that what actually the efficacy of the diet, and simultaneously we can take the Miracle Drinks New Ayurveda treatment. Thank you.